our samples. Our doctors or our nurses will draw the blood and place them into tubes. The lab provides us with different colored tubes that are intended to protect and preserve the blood sample so that laboratory diagnostics, certain tests can be performed on it at a later time. So we have our what we call lavender tubes. These are purple tops, and they include EDTA, which is going to keep the blood from clotting. This is what we use to run our CBCs. Sometimes we'll need plasma, and we will spin these lavender tops down, separate the liquid portion, which is our plasma, into a non-additive container. Now this is what we call our, we call them tiger tops. The old tubes used to have little lines on them, but these are like our yellow and grays. You can also call them red top tubes, serum separating tubes. They have clay that will separate the sample. The sample has already been spun down. So you can see the liquid portion up here. This is our serum. Easy way to remember, the liquid portion of clotted blood is called serum. Liquid portion of whole blood is called plasma. Each sample is labeled with the pet's first and last name, and when the samples are brought over, we place them all together so it's easy to find them for our lab nurse. This sample says Pete Jacobson. This is a urine sample. It's put into a no additive container. The other piece of information that is good to have on here is the type of collection of this urine. And for Pete, I actually collected earlier. This is a free catch. That means that I walked him outside with a ladle and actually collected the sample midstream while he was going. So now I have also a fecal container for Pete. Fecal sample was collected and placed into this container, and so now I can actually send this off to the lab and have Pete's blood tested. His fecal sample will be tested for intestinal parasites. Now, you heard that ding a few seconds ago. This is our centrifuge. I'm waiting for the rotor to slow down to a complete stop. You never want to stick your hand into the centrifuge. You could easily get injured doing that. So while that's spinning down, you can see here I also have another sample, Mabel Reynolds. This is a lavender top, so this is going to be her CBC. One thing I will do in preparing the sample is look to see if I have any clots. This would not be a viable sample for me to send in if I saw a clot, because this is whole blood, and that would alter our testing. Okay, so now our centrifuge has stopped. Mabel Reynolds, this is her serum separator tube, her SST. You can see we've got our red blood cells have been separated out. Our liquid portion, so our serum is up here. So solids down below, you have your clay, and then your serum up above. So now I'm going to put that with our lavender top. And then this is a sample. This was what we call a red top tube. So this is different from that yellow and gray. This is black and gray. This does not have clay in it. So if I have a sample that cannot have clay, because it will alter one of the chemistries or such, then we would use a red top tube. When it's pulled out, any liquid portion that is separated, we would pipette that off of the sample. And this sample looks like it has been separated out as much as it possibly can. The lab nurse was just trying to see if there was anything else she could get off of that. Okay, so next step, I'm going to take our samples and preparing them to go to the lab. We use IDEX. IDEX provides us with these great little plastic bags. So Pete's urine, Pete's lavender top, and Pete's serum separator tube will all go into this plastic bag. And last but not least, his fecal sample can either go into this bag and all be sent together, or we can send this as a separate item. We prefer to do that just because we don't want to possibly contaminate the blood with fecal matter. Now, IDEX, with these little bags, they have a little section on the opposite side where we can put paper where it won't get wet. So now I'm going to take my samples over to my computer and get my submission form ready to go. Alright, so now I'm going to show you how to take that sample for Pete Jacobson that we put into our IDEX bag. We're now at the lab computer, and we are going to do a quick search and print out a submission form to send to the lab with his sample. I'm going to zoom into the computer so you can see here. The IDEX software is called vetconnect.com. That's their website. So now I'm going to do what's called create a requisition. So I'm going to search for my patient, put in Pete's name. The computer does a quick search, looking for Pete. Alright, so let's see. Here's our Pete's and Pete Jacobson. Okay, so now I'm going to select my doctor. It's Dr. Johnson who is submitting this sample, and she has requested a 2090, which is a young canine maintenance. It'll be a CBC. It's a chemistry 25, as well as electrolytes. We are also going to have this urine submitted. So we do what's called a urinalysis add-on. I'm going to hit next, and now it's going to ask me to answer a question, urine collection method. I know that this is a free catch, and scanning down, I look to see if there's anything else. It will tell me what kind of a sample it needs. So remember, I have my serum, which is my serum separator tube, and an LTT is a lavender top tube. For my urine, it tells me I need 5 ml of urine in a sterile container, so that no additive does meet that requirement. So now I can print and finalize. So now you see we have our requisition form, and it gives you the name of the client, the patient, and our tests are here. That's the barcode that IDEX will use to scan. So now I will print. Okay, so now we have our requisition form for Pete Jacobson. I'm going to fold this. That way my barcode is accessible for the IDEX techs to scan when the sample is processed at the lab. Now, requisition form goes in that little section on the back so it doesn't get wet. And now this is going to go in the refrigerator. We have a container that the samples sit in until the carrier comes to pick everything up. It's kept cold, that way that the blood isn't deteriorating and cause false results on the testing. This is our laser sight machine. I'm going to show you how to clean it. We have a weekly checklist that is given to us by IDEX. On a weekly basis, we clean the air filters. They have us restart the computer system, as well as back up our data. What I will focus on, though, is the air filter aspect and the actual piece of equipment. We've already done our backup and restarting of our system. So the actual laser sight machine has 2 compartments. I start on the left, taking everything out. There's usually dust down inside of here, so I take just canned air and lightly blow out anything. I can also lift the divider out. And most of the time it's not too bad in here. There's no major equipment pieces in here that can be damaged by the canned air. There is a filter located back there that if the machine tells us it needs to be changed, then we change it. We have our waste bottle. Periodically has to be emptied. There's a sensor on one of these rods that when the level reaches a point, it will send us a notification saying it needs to be emptied. So I'm going to go ahead and do that. And we just simply pour, that's just like waste water, gets poured down the sink. Screwed back on there. The other side is our sheath reagent. Once it gets to a very low point, again, the machine will tell us that the reagent needs to be replaced. We average replacing that probably every 3 weeks or so, depending on how many CBCs we are running. Now, on the other side here is the tray that actually pulls in our tubes. So I pull out these two tubes are number 3 and number 4, which correspond with the number here. So I look to see if there's any cracks, any obvious reason why, I should replace it. Every time we go through a cycle of CBC tubes, these are replaced. So right now, these are still doing well. I see a little bit of dust, so I'm just going to lightly there. And then at the bottom of this machine, this is the filter that on a weekly basis, I'm going to take this over a trash can and in there to get all that hair off there. Alright, so now that's clean. I'm going to go back on the machine, slide into place. Now for the outer part, I'm going to use a hydrogen peroxide based cleaning wipe that are called rescue wipes. This will help to remove any bacteria, debris, blood, and I just wipe down the. So once we complete everything for the week on our checklist, we put the date and then our initials. Alright, so now I am going to show you how to do a ELISA snap test. We are going to do leukemia FIV combo. So our box that it comes in is from IDEX and comes with instructions, easy to follow. Each snap combo is in its own little package, and then we have our conjugate as well as our little sample. So we're going to take these items and actually run a test. Alright, so you got our snap combo test. We're going to open that up. You've got a pipette. You've got your snap kit. Verify that it says combo on it. And to run any snap test, the lab has us do serum. So I've used a little micro gold container, and we have spun this down. So this is just like taking a larger serum top SST, a serum separator tube, and now this is just a smaller version of it. To run this test, I'm going to take 4 drops of blue and 3 drops of my serum sample. So 1, 2, 3, 4. And then 3 drops of my serum. I'm going to siphon that off. 1, 2, 3. Save anything else I have in case I need to run the test again. Okay. Now I'm going to show you how to actually use our in-house equipment to run this test. So we go to our IDEX Vet Lab. Going to analyze a sample, so I need to put our patient in. There she is. This is a cat, and she is 6 months old. Okay. Have our doctor who is requesting this test, and our requisition ID. Okay. So now, I'm going to choose our snap. Run that. So now it's going to send to our snapshot machine. We'll get it set up over here. We're going to select. Gives us the option of combo, feline, and there's also a triple. And we'll hit next. It also is going to ask me what type of sample. So here's our serum. And then we hit next. Okay, so now it's ready for me to load. So, I'm going to come back down to here. Remember, we have our 4 blue and our 3 blood. Rock. Make sure everything's mixed. That gets poured into our well. I'm going to watch for that blue liquid to go all the way across. Once it gets to the end there and starts to show up in this little dot there. There it comes. And we can snap that down. And then that goes into our machine and it begins processing. So now that test is going to take approximately 10 minutes. Once that has completed, we are going to see what our result is for our ELISA snap test for our leukemia FIV test. We have our printout, and the printout says the results should be negative. Alright, so now we go to our snapshot. We're going to pull out our, and we look, there's our control dot. We're looking to see if there are dots on either side. The reason I know that is when we go to our lab station, I can view my result here, which is negative and negative. If I want to edit the result, the computer system will actually give me the option to tell me what is positive. So then I can take my own snap and see what it lines up with. Obviously, that lines up with the negative. So we are going to demonstrate how to do a ear cytology. Viva is going to stand very still. Hey, you're all right, Mama. I have my clean cotton tip applicators that I will be getting my samples with, and I have my clean microscope slides. I'm going to start with her left ear. I'm going to go gently down into her ear canal. She's a little dramatic. And I am going to use frosty side up. I'm going to make an L. This will be my way of knowing this is my left ear. Now I'm going to go for her right ear. Hey, sweet girl. No! You're all right. I know. I'm going to be gentle. I can go a lot quicker on this side. Oh, it doesn't hurt, Mama. Okay, now for her right, I'm going to make a little square on this side. Alright, I'm going to take this to the lab. I know that that is my left ear. Obviously that is on the right side, that would be my right ear. We have our ear cytology that we took from Vila. I'm holding on to my swabs. My left ear, before I place everything down and mark it, I'm going to go ahead and break. That way I know which swab is which. On my ear cytology, remember I have an L next to my frosty. That's just my way of always knowing where my left ear sample is. My right ear's on the other side here. I'm going to take my marking pencil and I'm going to put my patient name. And then I'm also going to put ear. Let me know, remind me that this is an ear cytology. So we have our quick dip containers here in our lab. We have two separate sets of quick dip. We do cell cytology, so this is going to be for mass aspirations, blood smears. The three up here are more likely to get contaminated. These are for ear cytologies and fecal cytologies. So, got my sample. I first need to heat fix my sample to my slide. I'm going to take about 10 to 15 seconds, just going back and forth. I don't want to do too long in one spot. Don't want to overheat it and cause the sample to actually deteriorate. Now that it's heat fixed, my sample won't just wash off my slide. I'm going to use one of my little holders, my slide holders, and open my quick dips. So, first, my slide will go into my number 1, which is my fixative. I'm going to do 10 dips. Then I move over to number 2, which as you can see is red. That is a my first stain solution. Do 10 of those. And then finally, I will move down to my third, which is what's called a counter stain. But it's a third stain, so it's going to do, it'll pick up on things such as yeast, bacteria that the red stain may not. This one, we tend to do about 20 to 30 dips, only because we want as much saturation of that stain as possible. That'll help the sample stand out more if there's things such as the bacteria or whatever. Otherwise your stain will be too light. Now I'm going to take this to my sink. Paper bag. Now I'm going to pull out my microscope. And turn on. I just want to make sure I don't see any obvious dust. Put my slide onto my stage. I'm going to start off on the 10 power just so I can get things focused. Right now, nothing is in focus, so I just have to turn my fine tuners and raise my stage until, there we go, until I can see. And I can adjust my light as well. Alright, so now I'm just going to find a little area that looks like it may have quite a bit on it, because as I increase my magnification, it'll be a little more difficult to find things. Okay, so now I am going to go to my oil lens, which is my 100 power. I'm going to place my oil. That is immersion oil. Now, take my 100 power, place it into that oil bubble, and now I should only have to turn my tuner very slightly. There we go. So now I'm going to scan. Remember, I'm on the left ear because that's closest to my frosty section. I'm just going to scan in a back to forth pattern, looking for signs of yeast or bacteria. I am seeing some very small bacteria, which would be little small round dots. These are probably staph, which is smaller than cocci on the microscope. So, not much on this left ear. There's more epithelial cells there. Now I'm going to scan over to the right ear so I can leave my 100 power lens still touching the slide. The oil will move over, keep everything, the stage and everything in place. That way I don't have to refocus, except for maybe the fine tear. There we go. So right ear, there's a lot more epithelial cells here. I am seeing, okay, there's a yeast, looks like a budding yeast, which is going to appear as kind of like a large dark purple circle with like a little head on it, like a little bubble that's starting to come out. There's more debris. A few staph bacteria. So this particular ear cytology, this dog has maybe a mild, there's another yeast. So we've got a little yeast infection starting. I'll tell my doctor I'm seeing like 0 to 1 yeast per high power field, and for my bacteria, I'll let her know there's maybe 6 plus over the entire slide.
It's your kitten. Alright, so we're going to do a necropsy on a roughly 8-week-old stray kitten. To begin with, though, we're going to use some personal protective equipment. We will have our aprons on as well as gloves. And just in case there are any infectious viruses or anything within this body, we want to make sure that we are protecting our face from anything that may splash. And Dr. Colleen Murray will be performing the necropsy. I'm going to start with a little weight on our baby.
And if we can, does the pets have to come in?
Well, if we can get a medical record that shows that it's been done, we can. If we can't get a medical record, then what she could do is she could just bring him in for a nurse visit, no charge, put him on.
He weighs 15.5 ounces.
And that's for the Revolution. Now, Frontline does she have to bring him in for Frontline if she knows her weight? Because I know you can buy that over the counter.
They can't buy.
So I'm going to record that on a sheet.
It's the gold. That's right.
Yeah. Okay.
I'm going to use just blank piece of paper, but I have the kitten's information here, the owner's information above. That way I can keep track of everything as I go. So Dr. Murray is going to do a brief external exam, and she'll give a little clinical history if she comes across any.
So this kitten was a foundling. He was cared for by a technician with his sibling. He was a failure to thrive. He had a severe upper respiratory when he was found. He had an eye ulcer on his right eye. Basically, over the course of a couple of weeks, he did try to rally, but slowly it became apparent that he was having increasing difficulty breathing. He was also retaining fluid in his abdomen. The decision was made to let this baby go. When he stopped eating, he could no longer eat, and all of his energy was being used to try to breathe. We suspect a congenital heart defect. We're not sure, though. Again, he was a foundling. His sibling is normal and has been about twice his size through the entire time that the two were together, and the sibling continues to thrive. So we have an intact male, 6 to 8 week old red tabby kitten, and we'll make a midline incision, and then we will proceed to collect some different samples from his abdominal and his thoracic cavity for histopathology. We'll use a number 10 scalpel blade. I prefer not to use a handle. I prefer just to hold the blade. We're going to cut down the linea. Right now we're cutting the skin. We're looking at a little bit of subcutaneous fat. I'm going to get a pair of most likely this kitten died of congenital heart disease based on his physical exam and the fact that he did have a significant heart murmur.
I'm going to take my samples, and I will create a label, which I'll show you here in a second, and then we will properly label our jar to be ready to send out for his. I'm going to make a label to put on my container to send out for histopath. I have handwritten on here so that I know that this is still the same container that I was using during the necropsy. I have today's date and the doctor's name on there. To send it out, though, we like it to be legible. On the little chart that I was keeping notes on as Dr. Murray was doing the necropsy, I was able to list here under samples. You can see I separated it from abdominal and thorax. So I'm just going to list these items that we know are in my container so that the labels. Okay.
Sure.
So you can see here on this label, we've got little male kitten. He was part of a stray kitten litter. Has the owner's last name here. Same information that was on my little list. The date will have Dr. Murray's name here on the label as well. I've got abdominal with liver, spleen, pancreas, left kidney, bladder, and jejunum. And then from the thorax, we took a sample of the heart and the lungs. This will now go on my container. Alright, so then now this is ready for me to send over to our in-house lab technician, who will then process it to send it to the lab.
Alright, so let's talk really quickly about rabies patients, ones that we suspect maybe have rabies. A doctor is going to be the only person handling the patient or people that have been specifically trained and assigned in handling the patient. The doctor will have talked to the client. They will have made the decision to humanely euthanize. And so the doctor will be protecting themselves wearing gloves, sometimes double gloved. They may decide to even have goggles, face mask, lab coat, gown. You can never have too much protection. The main thing is protect the saliva is how the virus is passed. So they're going to be very mindful when handling the mouth. They're also going to cut off the head, and they're going to be sending that to the university where the head will be tested further for rabies, or I guess a confirmation in some cases. So to send the head in, they're going to have to cold pack it with ice packs and wrap everything up, Ziploc bag if they're able to. The box will be labeled very clearly. They're going to probably have notes within it, rabies suspicion, doing anything that they can to protect the people that will be opening that box and handling the contents within. The rest of the body must be cremated. Most hospitals use some sort of a crematory facility, so the body can be wrapped in a body bag and then tagged with appropriate labels. They'll probably still go ahead and label it very clearly, suspected rabies. That way the crematory will know that they need to be very careful in handling the body.
So we are going to do a vaginal cytology. This is a 2-year-old female, and I'm going to take some normal saline. I've got a pair of gloves out here that I'll be putting on. I've got a fresh, clean slide, and then I have this is not a sterile procedure, but we do try and keep things as clean as we can. Exterior area of her vulva. All right, sweet mama, I'm gonna move your tail over here.
You tell me I need to hold her.
I think she'll be okay. This is just to hopefully remove any bacteria that may be within that vulva. All right, so I've got my cotton tip applicator that is soaked, and I am going to gently, okay, sweet girl, enter, and then I'm going to be doing a 45-degree angle roughly. Don't want to force anything. Good girl.
Good girl, boom, boom.
Almost done. Okay. All right. Good job. All right. Now I'm going to roll the swab on our slide. I'm going to let that dry, and then I'll be able to read that on our microscope. All right, so now we have our vaginal cytology, and I am going to ink fix it and stain it. And then just like my ear cytology, we have separate dip quicks for our like aspirates and cell cytology versus our ears and fecals. So do 10 dips in my fixoscope. Microscope. I'm going to start with my 10 power to find my cells. Okay, now I can go to my oil. Use my immersion oil and my 100 power oil lens. Definitely lots of neutrophils.
Got epithelial cells here.
And I'll get the, I'm gonna get the conveyor right now.
I'll get the blood.
Okay.
Nucleus is, excuse me, large.
Hey, Courtney.
Scan through here. More
Hey, Courtney, can you get a
neutrophils.
photo? I want to get a photo of his chest.
Of that itchy
Yeah.
spot? Okay.
Not seeing any red blood cells. There's a few cocci in here. Bacteria can just be from the vulva. Alright, so no signs of cornification. Her vulva was quite small and normal, no bleeding, so I can assume that this dog is either in an anestrus, just about to come into heat, or she has finished a heat cycle and is in mid-estrus. Alright, so let's talk about the stages of estrus. The first stage is called like the preparing stage. It's pro-estrus, and it can last 9 to 11 days, all the way up to 21 days. This is when you're going to see the bloody discharge from the vagina. The female's vulva becomes very swollen, it's very obvious compared to her normal size. You'll have males attracted to the female because her scent's going to be very strong. But at this stage, the female shows no interest in the male. She's not ready to breed at this point. But if you collect epithelial cells from a vaginal swab and look at them under a microscope, then in proestrus, you're going to see that your epithelial cells will start becoming larger over time. In your first, like the last stage, or if you want to call it the first, middle stage, it's the anestrus. The cells are very small, they're round, the nucleus is very dark. But in proestrus, the body is getting ready to breed. So those cells are going to start changing. They become larger, they become angular in shape. The nucleus will start having very little stain to it, and you'll start seeing a large number of epithelial cells on your slide. You'll also start finding red blood cells, white blood cells. Hormone levels will start increasing, the estrogen level followed by progesterone. That's when breeders will typically start testing because you can track the progesterone level, and that allows them to have a better chance of a breeding taking if it's, say, a show dog or such. In the next stage, it's called estrus. Estrus is when the female is ready to breed. She's ready to accept the male. This stage lasts a good 9 to 11 days, can last up to 21 days. This female is ready to flag, so her tail will raise. She will allow the male to come and sniff her rear end. She'll allow him to mount her. She's becoming ready to breed. Microscope, you'll see very few, if any, small epithelial cells, and we can be looking for a hormone called LH to spike, and typically when that occurs, the ovulation occurs in about 24-48 hours. So the breeders are able to kind of time, by tracking the hormone levels, they can kind of time when they're going to plan their breedings, and they'll typically do it like 2 to 4 days after the spike of that LH. And then in our next stage, it's called diestrus. So now the progesterone level is really high. It's going to last a good 60 to 90 days if the female did not become pregnant. If you have a female that's not spayed and it's just a family pet or whatever, then she obviously wasn't bred. So the big concern here is the development of an infection in her uterus called pyometra. So some dogs will look like they're having a false pregnancy. So the breeder or the family just has to look for signs of her having a high fever, not feeling well, not eating. She may have kind of a greenish, smelly odor from her vulva, maybe a discharge. The bleeding, the discharge from the vagina, as far as the estrus cycle, has stopped at this point, and the epithelial cells on a microscope are usually back to being that small round size again, and you're going to have a high number of white blood cells because it's trying to clean out the vagina to get rid of all the old debris and stuff. And then our final stage is called anestrus, and that lasts 4 to 5 months. It's the stage between heat cycles. The sex hormones are really low, and on the microscope you're going to have very few, if any, epithelial cells, and the ones that are there are going to be back to that very small and round size.
So this is going to be my donor for my cross-matching video.
You look terrified.
Alright, now we're just going to hold still.
Hey, no. Here. Someone doesn't like to be on the ground.
I'm going to draw some blood. And then we're going to use a lavender top EDTA, which will be our plasma sample.
These weekends are so weird. This is different.
And then also a serum separator tube for our serum portion. So now I'm going to draw blood for my recipient to fulfill this cross-matching video.
Okay. Good girl. You want the knife off?
No, it should be okay. All right, we're going to be nice and calm.
You're hungry. Your mouth's dusty. Okay, baby.
Bottom left.
No.
Oh, Mama.
Hey.
This is Mugsy.
Mug food. Hey.
My friend.
You're a good baby.
Girl. All right. Perfect.
Good baby.
So again, we'll do our lavender top for our plasma portion. And the serum separator for my serum. I've also labeled the tubes, recipient and then donor, on the other dogs. We're going to go ahead and take our donor sample and our recipient sample, and we're going to spin down both the lavender tops and our serum separator tubes.
Ashley. Yeah. Come here.
Yes.
This is what the building looks like.
Yeah.
Alright, spin those down.
It was on the picture.
15 minutes. Yeah. Our centrifuge will be stopping here in just a second. We'll be taking those tubes out.
Oh yeah.
I can go ahead and get my other tubes that I'll be decanting into. And I'll go ahead and start labeling those. Got Bugsy is our recipient. Alright, so that's our centrifuge. Just finished spinning 15 minutes, and we'll wait for it to stop. Grab my...
Okay.
Alright, so it's come to a complete stop. I'll go ahead and grab my samples.
I think it has to be
Got Mugsy first.
Shreveport.
So we've got our plasma and our serum. It's going to end up going up there. You'll have to get a step stool to be able to do that.
Okay. Well, why don't we see it? Why don't they just dot the map and show us what they
All
have?
right.
Do they have something broken out by
There's
state?
Mugsy, serum.
I can just call.
Just call and find out that we have a client that's moved to Arkansas, Texarkana. What is their, whether it's Texarkana, Texas, or Texarkana, Arkansas.
Okay.
Let's find out what their choices are. When you call, get me an answer, okay?
All right, so now I'm going to pipette off my
Does anybody know a vet in
plasma.
Frisco?
Yeah, where Kevin used to work, there's an excellent animal.
Okay.
I don't see it in the store. Frisco West. Bigger factory.
Frisco.
Who's
West.
watching it?
We'll get that for them.
Okay, so I've got a little bit of plasma.
Oh, it has a good coat.
Now,
Good guess.
let me grab my Bellatrix. Okay, so now I'm going to take my lavender top tube and actually wash the red blood cells. To do that, I'm actually going to use my centrifuge, my small stat spin, and I've labeled a stat spin container with an M and a B so that I know that it's Mugsy or Bellatrix. So I will take the corresponding lavender top. I'm going to take 2 drops of my blood.
Okay.
And then I'm going to take sterile saline. And I'm going to fill up the rest of that container. That little that'll be my first one. And then I'm going to do the same with Bellatrix. Taking a new clean pipette.
Okay, what were you asking me? So she wanted us to scan her microchip and all that. But she's already been done. She told me it
Okay.
hadn't been done.
So now my 2 samples are going to go into my stat spin. And I will let that go through its cycle. So now my centrifuge has stopped, my little stat spin. So I am going to look to see. I've done, this is the first of 3 washes. You can see that my suppellant has actually already turned clear. So I'm going to now pour that off.
That's what I'll put back as.
And now I'm going to repeat that same thing of adding the saline to my little stat spins 2 more times. Do this a couple more times. Okay. Mix those together. Alright, so this is the second time, second wash. We'll go through that same whole process. Okay, so stat spin just finished our second wash. We'll pull those out. Nice and clear. Gonna pour off our clear liquid. And then I will do my third and final wash. Still have my sterile saline that I put into my 3cc. So use that. Okay, final spin. Okay, so our stat spin has finished spinning the third time. And we will pour off our Sprilla. I'm just going to flake that there for just a second. Okay, and so now I'm going to make a suspension. Taking some of my samples here. So to make a major cross-match suspension, excuse me, I'm going to take 2 drops of my recipient serum. I've labeled a little tube as major and minor. So 2 drops of the serum. And then I'm taking 2 drops of my, to make my suspension, sorry, 0.98 mils of sterile saline. And then I'm going to take 0.02 of my packed washed red blood cells. From each sample. Make sure I get all my air out of there. Okay, so this is 0.02 of Bellatrix. Okay. So that is my donor. I'm going to make sure I put donor suspension, just so I keep everything straight. And then I'm going to do the same thing on the other.
Kittens do nothing for me, puppies do nothing for me. I have, like, it does nothing for me, but it's because I've been doing this too long. That's because there's a toxin. That's literally like the only thing that, like...
Alright, so I'm getting my air out. Taking it down to 0.02. Go. And now I'm adding that to make my recipient suspension. Okay. Okay. Those are the suspensions. So now I'm going to make my cross match. For my major, I've got 2 drops of my recipient, some Mugsy serum, and then I'm going to take 2 drops of my donor cell suspension.
She does think so, yes.
Clean pipette.
All right, and you can call us from the parking lot too if you guys need help getting him in. So we're happy to do that. You want to just give us a shout when you get here, okay? You're welcome. We'll see you then. Bye-bye.
So those two are mixed together now. That is our major cross match. So now we're also going to do a minor cross match, which will be 2 drops of our donor serum and then also 2 drops of our recipient erythrocyte suspension. So another clean pipette. Keep everything separated. 1, 2. That is our minor cross match. Okay, so now our next step is to check for autoagglutination. So I'm going to set up 2 controls. This will be our recipient control and our donor control. To do that, I'm going to take never have too many pipettes. I'm going to take 2 drops of my serum from my recipient, 2, and then I'm going to take 2 drops of the recipient cell suspension. Okay, so that is going to be considered my recipient control. And then I will do the same for my donor. 2 drops of my serum. 2. Two drops of my donor cell suspension. 1, 2. And that now becomes my donor control. Now I'm going to let my controls incubate at room temperature in my little black tray here. While that's happening, I'm going to clean up my mess. Give myself a little more room here to work with. And we'll be back in 30 minutes. Alright, 30 minutes has passed, so now I'm going to take both of my controls and then my major and minor cross matches. And actually, I'm going to spin those down in the stat spin, 1 group at a time. So I'll do my controls first, and then my major, minor second. So now, we have spun down our controls, and I have spun down my major and minor cross matches. I want to look and see what is that clear, or what does the liquid portion look like. And all 4 of these have a ever so slight pink tinge. So I would say that is slight hemolysis, which is going to be insignificant. So then I will take each tube and just lightly tap, see if I see any gross agglutination. And it seems like it's falling pretty quickly with my donor control. So here is my recipient control. It's actually looking good there. This is my major cross match. Same thing. Looks like it is falling pretty quick, so I will look under the microscope for these. Same thing. This is my minor. So that was probably the most
What's this?
grossly.
Where's that coming from?
So it's not, the color of the liquid is actually staying clear. So I'm not actually going to call that hemolysis. This is agglutination. So now I'm going to look under the microscope. Alright, so now I'm going to look under the microscope for signs of autoagglutination, which basically indicates that my red blood cells are clumping together instead of being dispersed evenly. So the test tubes passed my hemolysis test. There was not major hemolysis going on. Now I'm going to put my little cover slip. I've actually set up my slide so I have my major drop on one side and my minor drop on the other, making it just a little easier and quicker to look at my samples. Going to get focused in here.
Probably not.
I'm going to go on my 10 power and focus. And then I can go to my 40 power. On my major slide here, my major drop, my red blood cells are evenly dispersed. Beautiful. That way. Now I'll look at my minor. And same thing. My red blood cells are evenly dispersed. There are no signs of clumping, which they would look like patches of, say, grapes and clumps. Everything is separated. Alright, so we're going to determine that Mugsy and Bellatrix would be a good match. If Mugsy needed a blood transfusion, then I could use Bellatrix as
So we're going to do a skin scraping. She's using a brand new blade, and she has put a little bit of mineral oil on a microscope slide, and she's going to scrape deep enough into the skin. You'll see that there's a little bit of blood starting to come up because there are some mites that are hard to detect unless you get down into that dermal layer. So now he'll show that. She's adding the scraping to the mineral oil, and then we will take that to the microscope
and look to see if there's any mites.
I couldn't find the other one.
So she'll take a sample from another little section, doing the same thing, going deep enough until we get a little bit of blood. Perfect. All right, now we'll go see if we have some mites.
I'm gonna go have a look at this. We need to do our blood though.
All right, so when you've done your skin scraping and you're looking under the microscope, you're going to be looking for two types of mites. We see Demodex quite often, and this is not zoonotic to humans, thankfully. Under the microscope, the mites appear as cigar-shaped or maggots with little nubs for arms and legs. You will also see a mite called scabies, which is zoonotic to humans. So those will appear as little mite shapes, round bodies, multiple legs. Those are the ones that live deep in the tissue layers and require us to do a deep scraping to get a little bit of that blood, to the surface.